We are live. Good morning, everyone. I'm Karen Hiller from District 1 and chair of the City of Topeka's Public Health and Safety Committee. It is 9:30 on Wednesday, April 16th. Welcome, everyone. Our meeting today has two focal points. We're having a presentation on social determinants of health with some guests, presentation and conversation, and then focusing on fines and fees for landlords, and Amanda Stanley from Legal is here. So we will get started with a call to order and introductions of the other committee members and get right on to our agenda.
David Banks, representative for District 4.
Christina Valdivia Alcala, District 2 representative.
Online?
Brett Kell, District 5 Deputy Mayor.
Thank you. With that, our second item is to approve the minutes of March 19th. Entertain a motion or any comments if there are corrections.
Motion to approve.
Second.
Motion to approve, second. Discussion? All in favor say aye.
Aye.
Pose same sign. All right, minutes are approved. We will move right into our first presentation. We have guests here. How many presenters do we have? All three of you? Go ahead and move on up. And I have introduction material for two of you, so you'll have to help me out. Danielle Twemlow is on my left. She is on the Live Well Executive Committee, chairs the Maternal Infant Health Subcommittee, and has a work affiliation with Stormont-Vail Hospital. Carla Hedquist, on my right, is Director of Community Health Engagement at Stormont-Vail Health, also serves on the Live Well Shawnee County Leadership Committee, and I'll let you introduce.
Yes, and I'm Teresa Fisher, and I'm the Director of the Shawnee County Health Department, and I'm also involved with Live Well Shawnee County.
All right. And
Chair.
I was going to hand off to you and give Councilwoman Valdivia credit for bringing this forward, please.
Yeah, it wasn't about getting credit. It was just asking if you could clarify to them how much time that we are engaging in this process.
I've allowed 30 minutes, hoping that we could get your presentation and then have some discussion, certainly amongst the panel, but if there are others in the audience that would want to ask questions or enter in the conversation, you all will be welcome as well. Thank you.
Thank you.
Go ahead.
All right. Well, good morning. As I indicated, I'm Teresa Fisher, and I serve as the Director of the Shawnee County Health Department, and am involved with Live Well and have been for many years. And we're really excited to be here today to talk about public health and the social determinants of health and the needs of our community. So for me, this is really a continuation of our conversation that Craig Barnes and I were here last October, and we talked about collaborative public health and the social determinants of health. So we're going to review just a couple of pieces of that, but hopefully you remember a few key takeaways from that. But if not, again, we're going to touch on a couple of key foundation pieces for understanding. Oh, here we go.
Is it on? I think it's on there. If it's dead, I will click for you.
I think you'll click. All right, so I'm going to open us up. This slide really is a global look at the public health approach, and for my team and I at the health department, this is how we approach our work every day. But it's important to know that this process is not specific to local health departments. That's the global idea of the public health approach. So I'm going to review basically from left to right kind of how we work through this process. And as we go through today, hopefully these pieces will make sense as we talk about our community needs. So on the left, when we talk about surveillance is really just gathering information. And so gathering information can be everything from a variety of data and statistics and numbers, but it can also be stories and interviews and people's opinions. So that helps us look at what the problem is. So once we've determined what we think the problem is, then we look at what the cause is. And so I like to use kind of the phrase of peeling back the layers. So when we are looking at causes, a lot of times we have to peel back sometimes many layers and many complex layers to really get at that root cause of the problem. When we get to this part is where those risk factors tend to play a part into it. And this is where the social determinants of health really come into play. We usually identify that they're at play in some risk factor identified in this part of it. So we've got the problem, we think we know what the cause is, and so for a lot of individuals, they really want to jump to the last box and just implement. But it's really important that we pause and we look at what works and what we should be doing. So this is a time where we like to ask a lot of questions. We also like to really have a collaborative learning approach. So for my department and I, we might be visiting with other local health departments across the state, but we might be looking at other communities, things that work well for them. We're looking at best practices, things that they've tried. You also, at this time, have to realize that your community is unique and know that whatever is going on in another community doesn't necessarily mean it's going to work in our community, but it's a great opportunity for us to learn from others. If we don't have to recreate the wheel, we shouldn't. So when we get to the last phase here, this is where the doers love it, because this is where we're taking those action strategies and we're really putting them into place. And that's a time where we look at the response. Did it have the desired effect we want, or did it not? Next slide, please. So social determinants of health. That second little box I talked about was those risk factors. So hopefully this slide looks a little familiar. If it doesn't, we hope it becomes more familiar to you. But this is really a condensed version of the most recent updated chart from Healthy People 2030 about what the social determinants of health are. So in its simplest form, social determinants of health are the conditions in which we're born into, which we live, we work, we play, we age, we worship, all of those pieces. And research tells us that about 60% of our individual health is affected by our social determinants of health now. So that's a really important research that's taken place, and it plays a factor in all of our work. So what does that mean even further? It means that your zip code has become more important than your genetic code. And if that's the first time that you're hearing it, it's going to take a while to settle with you. But if you've heard it before, it's still a really profound statement to realize that, because it's not historically what we've all thought. So we know that all of these affect our mental health, and all of these factors affect our physical health. So even though I said this is a condensed slide, it's a really complex slide also, because when we look at these and we realize that we want to move the needle on some of these, it's a little daunting when you're starting to look at this work. And so for us, we really like that collaborative approach. So how do we work together? And so it's just that, it's working together. So it's working maybe with your normal community partners, the people that you're always go to, but maybe it's the atypical partner. Maybe it's the person you've never even met, or you've only talked about once, but you're like, this is an opportunity. But it's the city working together, it's the county working together. It is a true community approach to be able to move the needle on these. So next slide, please. When we talk about really kind of going back to the beginning again, but how do we understand those problems? This is where our community health needs assessment comes into place. So we know lots of individuals, and I'm sure you guys are told lots, like these are certain problems, but from a community approach, when we look at really identifying what are our community's challenges, what are the problems, we use a community health needs assessment. And all of you, this was hot off the press when Craig and I were here in October. If you don't have your copy, we've got extra copies here today. Or if you just want to take extras because you think other individuals need a copy, please do so. Because what the Community Health Needs Assessment is it's a tool. In its simplest form, it's a tool that we use to both examine and improve the health of our own community. And so this tool was used here in our community, but it's a well-known tool throughout the state and nation. It's very comprehensive, so it's not a small one-pager at all. It's very comprehensive. It gives information about what different health risks were identified, and Carla's going to talk more about how those were identified, but it really gives insight into what's going on specifically in our community and how we can work to identify those needs. Next slide, please.
Good morning.
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 So I want to dive in a little bit deeper to the Community Health Needs Assessment, because it's not something that should just sit on the shelf. It's like Teresa said, it's got a lot of depth, and we worked really hard to gather this information. And quite frankly, we're proud of it, and I'll get to why in a little bit. So the process for a community health needs assessment starts with the perception survey, and I'm hoping that you all took that last spring, and it is multiple questions, but it's for me and my family, my perception as you take the survey. And so it's questions about access to care, preventive care, the health and social determinants, and then the demographic information, because we want to be sure that we're gathering information from everyone. The results of that survey these were the top priorities: mental health, obesity, neighborhood safety, healthy eating, and safe, affordable, accessible housing. So those were the top things that survey respondents said. But we know that not everybody takes the survey. Not everybody thinks that it's for them or that their voice matters. And so we are very intentional about doing some roundtables, some 1 hour, more relaxed focus groups with underserved individuals. And so that is in a group setting. What do you think the strengths of health of our community is? What are your concerns? What are you worried about? What could we do better? What are some solutions? And so we gather and document that information. And then, of course, we ask them if they take their individual survey too. And so we did 12 roundtables last spring. We had 140 different residents, and if you want to see the breakdown of all those identified groups, that is in here. What they added to what the survey respondents said was, we're also concerned about substance use, and we're concerned about transportation. So those were 2 additional call-outs to what we heard from survey respondents. So between the surveys and the roundtables, we've gathered perceptions, but data is important too. And so we have to look at the data and see if that matches up with what people are saying and then how it supports each other. And so we rely heavily on county health rankings, which is many sources of data that comes out every spring and gives you a picture of each county across the state of Kansas and across the nation. So we look at the data. So we gather all of this information, the survey responses, the roundtable responses, and the data, and we present that at a town hall. And that's where we ask key stakeholders. We had 55 key stakeholders representing 41 organizations at the public library come together, and we present all those results. And then we have that conversation at tables saying, what does this mean to you? Does this fit with your perception? What do you think? And then we also have like an individual voting at the end of that. And that's how we determine what our priorities will be for the next 3 years, looking at all of the sources that we have. Any questions about that process before I move on? I make it sound easy, but it takes a long time. Yes.
I was going to save a whole bunch of questions and talking, back and forth till the end, but usually how long does this process take? From the time it starts with the ideas and what you all do, your meetings first thing, community, to getting all the information to when you have this printed?
A year. Well, 2 years. We plan for a year to how are we going to work together, making sure we've got the leadership team put together, designing the survey, our timeline, our marketing material, like how are we going to get the word out. So that takes about a year. The survey itself is open for 6 weeks. And then at the end of that, then is when we have the town hall.
Thank you.
Yeah. So it's a lengthy process, but it's worth it. So the next slide is the one that I am so excited about. We had 3,816 survey responses this year. We had 2,536 3 years ago when we did this. So we are really proud of the survey responses. I'm not sure what a normal survey is in Shawnee County, but we feel like we're up there with the big dogs in terms of responses on this. But what's more important to me is not total numbers, but that we worked so hard to be demographically representative of our community. And so you can see that there are only 2 areas that we fell short. One is more females take surveys than men. We had 203 more male responses this time than 3 years ago, but we still could not move that needle. It's about a 50-50 breakdown in Shawnee County. Age was fairly representative. I'm really pleased. We had 9.6% of Black and African American survey respondents compared to 8.5% of residents in Shawnee County. We also fell short in the Hispanic, Latino, Spanish-speaking category with only 9.54% of our respondents coming from that group versus 13.4% of Shawnee County. Again, we had 181 more responses there, but still fell short of our goal there. Everything else, income, we are so proud that we feel like we heard the voice of Shawnee County in putting this together. We met every week as a leadership team as the surveys were coming in, not even looking at the responses to the surveys, but looking at the zips, the demographics, like, okay, we don't have many from Rossville, let's work on that. We don't have many from Auburn, let's work on that. And so trying to make sure that we were demographically representative of our community. Next slide, please. Oh, you're already there. So town hall results. So as I said, combining all of the information, the surveys, the roundtables, the data, and then looking at it as a town hall, these are our priorities for the next 3 years. Behavioral health, which includes both mental health and substance use. Neighborhood safety and housing, which is new. That has not been one of our top priorities before. Food security, which is healthy eating, accessibility, and really the survey response was obesity. And the town hall said it's access to healthy food where we want to start. And then health equity continues to be our 4th priority, where we can really dig into those disparities, because what one overall survey may look like we're doing fine in, but when you dig down in deeper, you can find the disparities that we still need to address as a community.
A question on that, on the infant mortality, it became really prevalent how zip code mattered, and I don't recall the main zip code for the highest infant mortality.
04.
66604?
Yeah, which was the last that we had it broken down. So over the last few years, sometimes the way they collect data shifts and changes, and they don't always report it exactly the same way. 04 zip code was the last identified as the highest zip code in the state.
In the state?
By zip code. And when they've shifted and adjusted for having infant mortality not necessarily being one of the top ranking, the health rankings like Teresa mentioned, across the state, because predominantly infant mortality has decreased in many of the counties across the state, with the exception of Shawnee County, Harvey County, Sedgwick County are a few, but we historically have actually just checked the numbers again because they were updated just in the last few months or couple months, and we have now seen even a greater disparity where it has grown from just a couple years ago to Black babies were dying at a 2.5 times rate of white babies in our community. It is now 5 times the rate. That number just increased again in the last few months with new reporting. So we have continued to pull that disparity out.
Thank you.
Since I have 66604, both the hospitals are in there. Does that, is it adjusted for the fact that the medical services are there?
Yeah, no, yeah, we don't, it's based on where they live, not. the hospital.
Well, sometimes they don't know. I mean, we deal with neighborhood police reports all the time where somebody's car broke down on 10th Street and they're in our data, or something happened on one of the major streets. And so I'm just checking.
It would be based on the mother's residence at time of death for the baby. So I know we get questions about it being a higher level NICU also, and so we might have those. But again, those go back to those home counties.
Just checking.
Yeah.
Yes, it's hard to swallow.
Yeah.
All right, so we have done the work, we know the priorities, but this is where the real work begins. And so I call this a racetrack. So the left side is community health needs assessment. Every 3 years, we're doing this community health needs assessment. We are identifying the community priorities and working that side of it. But then the next step is we develop a community health implementation plan. And so that is over the next 3 years, how are we going to work together as a community to develop strategies and interventions that will address those priorities. And that is where our Live Well work groups come in. They are really the grassroots community. I will say that as a nonprofit hospital, we are required to have a hospital implementation plan. You can find that on our website. I think we should all have a hospital implementation plan or a city implementation plan or a health department. Like, if we're all looking at these priorities, and then what can we do to address those within our scope? And then have individuals, the hospital has representation on all of our work groups as well. So we have to work together, but we also have to do our own part.
And then we have copies.
Yeah, so Teresa has our last community health improvement plan. So I want to be sure that you understand that as you receive this, because we are in the process of developing the next community health improvement plan. So this is the strategies and interventions that have been in place for the last 3 years that we've been working on to move the priorities from the previous community health needs assessment. But this will give you an idea of what the current work groups are working on, and then you'll see a lot of overlap. The work continues. This is big work. It's not something that you can accomplish in a quick amount of time. So Live Well, like I said, is the grassroots, the hands-on, the community coalition that really helps us as a community come together to address each of the strategies. So I'm going to let Danielle cover Live Well.
Yeah, thank you. So Sarah Carnes, who is the Live Well coordinator, Pathways coordinator for our community, is at the Pathways conference today. So I hope that we can, as we're talking about ways that we continue this conversation, can have her on for the, this being a reoccurring piece on your agenda so that we can continue that and she be here for that next conversation. So Live Well, you might be familiar with Heartland Healthy Neighborhoods. A rebranding happened last year, but Heartland Healthy Neighborhoods has been around since 2008. It has been that grassroots coalition that has multiple organizations, community leaders, and members from across our county who come together, most of them monthly, for meetings to collaborate on solutions that are part of this process of the CHIP and the CHNA. They're the people who are working with individuals within our community every single day, providing services, or just neighbors of people who are working within their community. So they're the ones who are really seeing these things play out within the community. But the goals were the same, collecting and measuring data. What are we seeing within the community? Where's the data directing us to the solutions that we want to see? And then developing the right tools to solve these problems. What do we need to do in order to help mitigate some of these things that we're seeing come up in that CHNA? And then implement that. What practices can we do? Sometimes it may be something as simple as an education campaign of people understanding access to certain resources, or that there's a lack of resources in certain areas. And it can be a wide range of things, but these community members are the social service committees and people who are doing that work with individuals can help see those gaps. They're getting that information in real time along with the data that we're putting together as well. So that's what makes these groups very powerful. So next slide, please. So the structure is Live Well Shawnee County is this overarching collaboration coalition, and then there are multiple work groups within that. Those work groups then have multiple agencies that come together for those monthly meetings, most of them monthly. As you can see, active environment, mental health, healthy babies. That one specifically functions as the community action team for the Fetal Infant Mortality Review Board. So the recommendations for healthy babies comes directly from file case reviews from that review board of the infant deaths that have happened in our community. So those recommendations directly come down for those action steps in that committee. And you can see there's like a subgroup of some of them over on the Pathways Healthy Kansas. There is a grant through Blue Cross Blue Shield of Kansas, which is the largest grant that Blue Cross has done in Kansas, where multiple counties have action grants to impact behavioral health, active living, healthy eating, and tobacco cessation. And there has been some pretty remarkable things that have come from this, and because of the really successful work that has been done within our community, it was announced at the town hall that that grant is continuing for Shawnee County for this next cycle, which is huge. So Sarah can give a lot more details on that, and it'll be exciting to see what she learned at this conference about what's happening next. And the Food Action Network, as you've heard probably over and over again, we have multiple food deserts within our city, and looking at ways to combat that, to make sure that healthy food choices are part of that. One of the really amazing things that came out of one of the healthy eating work groups is work that they did makes it where SNAP benefits, or what were previously called food stamps, so SNAP benefits are tripled at the farmers market. Absolutely massive undertaking. So that's really, really huge. And it is definitely hard work, right? It is, these organizations are volunteering their time to come together to problem solve, which says a whole lot. So that community health needs assessment and that community health improvement plan, as you can see in the middle there, is because that is that working document. This is a collaboration piece that works together.
Can I?
Yep.
One thing that I think is really unique about our community is you do see, right? You see there's 8 different organizations represented there, and on the slide you might recall some of us are required to do that, but we're all required at different years, and we're not required to do it together. And so this year we added on additional partners that came together, and so that just really impacts our community by having a really, really comprehensive, cohesive CHNA.
Yeah. Not all communities do that, and I think having that response of surveys kind of goes to show that we're stronger together, right? So when we're all working together, we can see better outcomes for sure.
Well, you're hearing the same voices, are working together to get that diversity. That's really a
And
great
de-siloing
accomplishment.
work. Yeah.
Right. Yes.
I have a question.
Sure.
So I have a lot of questions, I have a lot of thoughts, and so are we ready to listen to some of those? Tell me one more
Yes.
thing.
No, there's just one more slide.
Go ahead and finish your slides, and then we'll.
Okay, yes, there's just one more about like how
Wow.
does local government fit in, right? So we talked a lot about, social services, boots on the ground, coming together, but of course it can't be done in a silo, right? It cannot be done without that collaboration of local government. These are examples of some ways that governments work with social determinants of health, healthy habits and behaviors within that community that can come forth via funding sources, ordinances, different practices. But I think what is super important is understanding what social determinants of health are and understanding what that public health lens is. And then it becomes just a practice as you're reviewing policies, procedures, ordinances, or even your funding distribution. So when it's something that is understood, that you feel familiar and comfortable with, you're more likely to utilize those methods versus, things might be brought forth that match those kinds of healthy behaviors and habits within that policy. And you might adopt that, but it's not the same as understanding how that intersects and how that impacts the community for its longevity. So we do things like we have complete streets. I know we just had that presentation at City Council. That is one of those components of social determinants of health factors, and we heard that great presentation. We have some of these in place, and hopefully we are developing more of these things and working on them pretty steadily. And a shout out to Mr. Scroggins, who assisted the Active Environment Group with Pathways to get the multimodal work across the finish line. I was given that directive to give that shout out. So that collaboration is really important. And sometimes not even knowing how these things impact community health and community safety until we have that public health lens. And I know we've talked in the past about the alcohol ordinance, for instance, or the fact of safe air quality. Actually, just the county health rankings just 3 years ago, one of the reasons our county health rankings dropped in rankings was because of our poor air quality, one of the worst in the state. And I think it was number 2. And so things like how can we impact and change that, which, adding safe green spaces, things like that. So understanding how those intersect gives a much broader picture. So the hope is, as we move forward, that this can, the health department, Live Well, can come forward and have a bit of time to update you all on what those things are happening in the community, what some of these CHIP goals are, because as we look at these CHNA results and how each of these work groups are going to fit in on addressing those, we develop goals. So you'll see in that, which ends this 2025, those goals are developed very specifically with interventions and objectives that are then carried out by those work groups, but do require that collaboration. So that's the hope that we move forward with. So thank you.
Thank you. Go ahead.
How much time do we have?
Well, we are at, let's go until the presentation has taken some time, so let's give at least 10, 15 minutes for discussion.
Okay, so the first, and thank you for this, because I think we can all say that we know about social determinants of health, but until we start speaking it out and we start educating people around us, and the goal would be, if the committee agrees to help educate the governing body as well, because not everybody knows that. But this is the question I have, and I don't know if this is a question for the chair or if it's a question for city attorney, is that if we wanted to develop a partnership with, I don't know, if it would be Live Well, if it would be county, what all it would be, but with that goal of you guys coming every month, us looking at how we can lean in towards each other, because while we may not have a lot of money right now, I can think of a million, metaphor, but I can think of so many different ways about the way that we can partner, and not only with the education piece. So what does that mean if Shawnee County Health Department becomes a mainstay of this committee? Would that mean, we have to do a recommendation and then, the council votes on it? I don't know, I'm asking, would that be a resolution? Is it okay just to say if the votes are there at this committee level that we would want it, or how is that usually?
If it's okay if I answer, I think listening to what you're describing, since it involves the county, it would probably be best for an MOU so that the county commission is on board with their staff being here on a regular basis, as well as the governing body as a whole. We do those fairly frequently, so I think it would just be a request from the governing body to have the city manager go enter those discussions and get something set up according to the parameters that works for both sides.
Okay.
I think before that, if we, some discussion about what the intersection is, what kinds of things. I've made some notes about things that we're doing that are totally part, I think, of what your scope is, but aren't specifically addressed, and for us to identify, through this conversation, which is what this committee level is for, is to identify, where those intersections are and what we do want to follow up on mutually. And so
I think that's where, like, the hope is in the consecutive months that the leads of each of these Live Well groups, Sarah, being able to come and talk about the grants that have happened and the projects that have happened within the community as well, but also have each group from Live Well be able to present to you on what things that they have accomplished, what organizations are at the table, and what are some of these goals that are going to be coming up, so that there's a really full understanding of what's happening at that level and how that might be a partnership.
So, Chair.
if I can hang on just a second, we've got some major issues that we're needing to bring back through this committee as well. We're at the 3-year point in our 5-year program and are reviewing what worked and what didn't work in retaliatory eviction and tenant health protections, for instance. We also are needing to bring forward the recommendations for updating our property maintenance code, which is huge, and John's here has been working on that, so that also is a huge project. And then city attorney is here today because one of the things we've observed is that the fines and fees that we thought were getting assessed and so on weren't. And so from our end, there are some pieces of our initiative. Hopefully you all are fully familiar with our initiative, but there's a mutuality here for us to then choose for your time and for ours to look at where those intersections are, I think, because we've got a pretty full, we're just now getting our data from the first 3 years of this program. When we started in COVID, we didn't have enough inspectors, nobody could talk to anybody, and so it was, the staff has advised us that 2024 is the first year that they're confident on. And this is maybe more information than you want, but we're changing computer systems, and so they're in the process of reclassifying all that stuff so we can pull the data that we need. So we have a lot of changing our culture of property maintenance items to bring forward as well. So we want to make sure that we've balanced for your time, and you may be actually interested in all of that stuff that we need to do and want to sit in on that mutuality as well. So just to give a scope. Yes.
With that, we've scheduled this particular committee for 2-hour meetings. So I think that we can do both with the voluminous amount of work that has gone into changing our culture of property maintenance, where you will see intersections, and but the needed amount for the continuity. And because I asked that of city attorney, isn't saying that tomorrow I want something pressed and committed. That's silly. We need to have the conversations that you're talking about, Danielle. We need to be able to flesh this out, to see where the intersections occur, to see if it is beneficial for an alignment and what those ideas look like.
Yeah, I think
And,
that,
yeah.
no, sorry to interrupt. No, I think that is also really imperative, because I do know that while I chair one of the groups, I do sit on some of the other groups because our goals are similar, right? Like, so, we have actually in two different groups, some intersecting things that come up in our goals that are also in two other committee goals. So sitting in, understanding what they're already doing and how we can make sure that what we're doing actually can just collaborate and
Right.
not both be working on a similar goal and instead working together. So as you know, you saw like housing, all of these things, these you know, environments that are healthy and safe. These next upcoming CHIP that will go into 2026 and on, community safety is a priority area. So as those goals are being developed, that is exactly those things that you're talking about.
Right, and I think that since we have at least 7 more months, and we can have a meeting every month, there is nothing to say, this is a pretty active committee. And so there's nothing to say that we can't have a, PHS meeting every month. But my suggestion is going to be to have at least one of those meetings committed to this, to where we can really dive in, ask the questions after we've had the presentations, and then offer the exchange. And what what can we benefit? How can this partnership, if we develop any type of MOU partnership, how can it happen? That is only going to come with where we are going to be able to have at least one meeting where we focus just on this. Otherwise, we're going to be bouncing around month to month to month, maybe being able to give you 20 minutes, being able to give you half an hour, and that's not going to do any good. I mean, it will, it's just going to take longer. So that would be my suggestion.
Thank you. Councilman?
Well, thank you all for a wonderful presentation. Just from the materials that you've handed out shows the effort and work that's been put into this health assessment. For me, I'm thinking my question would be to you is that men play an important role in health issues. So I wonder when you're doing your surveys and the men don't participate as actively as the women, what do you do to get them to realize how important the surveys are?
Like I said, we meet monthly or weekly during the survey process to say what can we do. And so we looked at different occupations that employ more men. We looked at Boy Scouts. We looked at all, different ways to target survey distribution to those individuals trying to hear their voice.
Okay.
Yeah.
Thank you, Carter. Thank you, Chair.
Sure. Councilman Kell, do you have any input at this point?
No, I'm good, thank you.
Okay. I've got some thoughts because I think it needs to be a two-way. One of the things that we've talked about a lot that has been a challenge we have not mastered is the whole, Councilwoman Valdivia Alca will be able to source it better, but I think at least Danielle's been involved in this. The issue of just that sense of safety by walking down the street and having vacant lots, trash, rundown houses. And there's data on how that impacts people. And we, starting at day one with this and changing our culture initiative, and the idea of just mowing and exteriors of houses and so on to change that. And we haven't had as much success as we wanted to, and encouraging, and the fundamental of what we talked about was people just helping themselves and helping each other. And when we, no matter what your income is, you can take care of your yard. You can keep the trash up, you can figure out how to get it mowed so that there's a pride in where you live and that people's heart rate doesn't go up when they walk by your house. And so that was one of our very fundamentals as we took on, what do we do to fix, the lens from changing our culture. That literally was changing our culture. How do we, instead of waiting for a code compliance to show up and write us up, how do we get that pride back? And as Councilwoman Valdivia Alca and I would talk to people about it in the early years, it was like, people kind of glaze over when you talked about that and you go, well, like it was in the 40s. And no matter how old anybody was, they would go, oh, yeah, I get it.
Yeah.
And so, I know that, for instance, with Safe Streets and Danielle's daughter we've needed community engagement and organizing people that were just knocking on doors and helping people build spirit in neighborhoods. And so we've got that little piece going, and I don't know if that's part of your coalition or not, But those kinds of things are really important to us, and not, you know, I was looking at this is not critical, but that the list, it's hard for people that are just filling out a survey to identify what the core problem is sometimes, and you guys have worked on that too, and I love that. But that's a piece that I thought of as we walked through this.
Yeah, no, so as community safety part in the community work that is being done on the violence reduction strategy is going to be a part of that next CHIP process. But I actually just spoke with Steve last night after city council meeting, because one of the block talks that was occurring, for example, an entire street of neighbors had gotten together and decided that the project that they wanted to work on was learn about the 50/50 sidewalk repair, and wanted to look at ways that they can get their entire side of their street sidewalks replaced and repaired, and what that entailed. And he's moving forward with going to, go look at those addresses to go see what might be the next appropriate step. But it was the community members got together, held a meeting, brainstormed the goals, and decided like that was the project they wanted to do, which was really exciting.
That's great.
And so I just had that conversation with him last night, because again, it led to if you're feeling safe and with your community, they can take walks and feel comfortable walking together and up and down the block, and more people are out and being a part of their community. And that was driven directly by the goals created by community members. And so just an example of how that process is happening.
That's where, that kind of example, I guess, is where I see us identifying those nodes that, we're interested in maternal health, but we're trying to do, with the focus on neighborhoods and housing code right now, if we were going to spend time regularly looking at, about what we both know about that engagement that's happening right now. We engaged with Omni Circle in the first year, because what we knew is a lot of people never grew up mowing their own yard, don't know how to run and maintain a lawnmower, and Omni is willing to continue to offer, coaching for how to do lawnmower maintenance. I have a neighbor who, the other night, I heard him rev up the lawnmower after dark and immediately ran over something. Just the fact that you're supposed to pick up all the sticks first and don't do it in the dark so you don't get hit with something and hurt somebody. Those fundamentals that for us to keep those yards clean and develop pride in that way.
If I could just one more, and I don't mean to keep, so that maternal health, so the pieces that came from the infant mortality, most of those things really impact the family environment. Not many of them are like directly related to the child themselves. And just to give a very quick example of when doing, and you've maybe heard me tell this story before, but it's worth repeating, where, following up with a family doing home visitation and, 3-4 children in a 700 square foot home, which was all they could afford, a lot of trauma in the family. After having a baby and doing education and sitting with the family about what they need and resources and development and all those good things, eventually coming to the conclusion that, in fact, mom had baby in bed with her. Through further discussion, which she knows every single piece of information, very engaged and active, found out toddler's also in bed with her, but then became very, very overwhelmed with the fact that she was living in a house that she did everything she possibly could to make sure that her home was warm. And because of the drafty windows, and because the maintenance and upkeep from the landlord was not there, and because she was afraid to turn it in, because she couldn't afford anything else, she was able to keep one room warm. She was able to buy the things that she needed to get the windows covered, to cover the doorway so that room was not drafty, and she felt being in bed with her baby was the best way to keep that baby warm. And so when we're talking about the intersectionality of how what is happening in multiple different realms of organizations, government, entities, we all impact the health of our community in various different ways, making sure that we're keeping affordable housing where people are safe and affordable. When we're able to do those things, those impact infant mortality rates. And there are data and studies that even show for every $1 that you increase minimum wage, we see a 2 to 3% reduction in infant mortality. So health really impacts in multiple sectors. That's where that zip code piece that Teresa put in there too. So I think that intersectionality of those pieces is actually broader than we think on the surface level.
Oh, absolutely. Just the fact that we've got a multiple things that we need to address as a committee. And so I wanted us to, maybe what we can do, because we are going to have to wrap up this piece, is make sure that you have our Changing Our Culture property maintenance objectives, as well as the recent analyses that we've done at that 3-year point, and that we can mutually look at least for our relationship, what the intersectionality points might best be, so that we can structure and have you back next month and just maybe check signals at that point. Yeah.
Question. I think they should do the presentations with all the entities that you said first to educate us. Isn't there more education with these living well committees?
There is.
So I would say that should certainly be something, because that to me sounds a little bit rushed. And
I didn't want to put it off, that's all.
oh, sorry, Dan. We need the full education if we even know if then the committee wants to establish an MOU, as you had said, or whether that would be the governing body, whichever one, everything. So, and then I would imagine after that, we decide how we want to handle that. And then once that has come into play with the MOU, then we can start talking about these things that you're talking about, but also talking about issues that they're having and how we can help bring that on board, even if it's through any number of ideas, social media, talking it up, partnering on videos. There's numerous ways that we can help. But I think that if we're talking about being deliberate, then we need to be deliberate about it before we make the determination and then get into the MOU and then start talking this.
My apologies on that. I just was thinking if we had to wait for another 10 presentations, it could be a long time before we came up with that intersectionality.
I think our proposal would be, we would love to have Sarah Carnes, who, as Danielle alluded, is not here today, as the director of Live Well Shawnee County, come, if we could, next month even, to really give an in-depth presentation about Live Well Shawnee County. I've been involved with Heartland Healthy Neighborhoods since its very first inception. Back then, and just for you to be able to see where it's been, how our community has embraced it, who has bought into this, where there's funding, there's a whole myriad of things that is having a paid director Sarah has been able to bring to our community. And I think that would be, before we even get into the work groups, that foundation piece of understanding what this coalition really is and what it means to our community.
Absolutely. And Chair, just one more thing.
Yep.
Social determinants of health have been out there forever and ever and ever. Mm-hmm. So we're bringing it in, we're educating ourselves, we're educating people watching. We know that we're educating, period. So it's not going to happen in one fell swoop. Education does not happen that quickly. And for it to sink in and not try to rush anything, because I don't know everything. And I need you guys to show me. I need you guys to tell me, and the people that you work with, so that when we really get into the meat of it, if we can establish an MOU, we know that all sides are ready. Thank you.
And I think once the deep dive, right, that we've done in these last couple times, and hopefully that, one more deep dive of what Live Well is, that the future conversations would be more like sharing information that wouldn't take a whole meeting or half a meeting, right? That's that establishment of what that means, and then it's really in that flow.
And my view on that is, after 3 years, I'm sort of impatient for us to find, I think it's wonderful that you're here to have more partners to help us get some of those things done. So thank you so much. We will get you our information so that you three and Sarah as well, if you don't have it, can look at that. And we'll look forward to having you back.
Thank you.
Thank you, Councilwoman, for getting this here. And thank you, City Attorney, for your patience. We will hand off to fines and fees discussion. Thanks again.
Happy to wait. That was an interesting discussion.
Yeah. If you would give that to Tara.
So
in the back.
I wasn't sure because I got some out last minute, whether or not you guys, if you don't mind, I brought copies for you guys. I also brought copies for members of the public that were here in case they wanted to read them. So a couple months ago now, I was at one of your committee meetings and asked by Councilwoman Valdivia Alcala in particular whether or not there was an ordinance we could put in place to make it clear that there were different expectations for landlords than regular, average, everyday citizens that maybe have code violations because they can't afford to paint or do other things, and they're waiting on grants through our housing services program with Carrie Higgins, those kind of things. And in talking with the court system and prosecution, the biggest thing that at the time came up is the issue of equity in the court system. We needed a public policy statement from the governing body that said, hey, this classification, there's a legitimate public policy reason why these particular individuals or businesses are being treated differently. And researching how to best legally accomplish that, I recommended an ordinance be drafted that says exactly what you guys had told me, basically, that everyone should have a safe and habitable place to live, and landlords are making money off these properties that is different than someone who is trying to stay in their home. So what we have done, worked with Judge Thadani, with prosecution, to draft an ordinance for your consideration. It's a little different than what you normally see. We don't normally have whereas clauses at the beginning of an ordinance. That's specific so that we get that public policy reason on the record to establish for the public that this is why we're doing it. So you'll see that the first page has whereas clauses that the governing body recognizes that these tenants are subject to living in conditions that are unfit for habitation, that they're not in compliance with property maintenance, that it can be safe and unsanitary, that it's the public policy of the city that landlords provide their tenants with habitable, code-compliant units. Then it goes on, the changes to the actual ordinance itself start on page 2, where it talks about the goal is to be in compliance with code, thus abatement of a person may result in a dismissal of the case. That's what we do with individuals, looking at income levels and grants and all of those things. The goal is if you can get in compliance with the code, generally we dismiss that case. We still charge the court costs as required by ordinance, but that a prosecutor shall not dismiss the case solely based off voluntary compliance if the person is a landlord as defined in code. So that gives prosecution solid legal basis to continue to prosecute those offenses even if landlord gets in compliance, while that same case, if it was an individual living in their house, might be dismissed. So it is a pretty simple ordinance on its face. There's not a whole lot of changes, but I do think it accomplishes the goal that you tasked us with of trying to figure out how to continue to prosecute landlords even when they get in voluntary compliance, so that we stop the cycle of a landlord forcing you to take them all the way to municipal court before they go ahead and fix it, knowing that then they can just fix it and get it voluntarily dismissed and only pay court costs. So I am happy to stand for any questions.
Let me start. How does this fit with the I was not involved in getting this initiated, and so this is new to me as chair. What came to our attention when we did the 3-year review was that the fines and fees weren't automatically being charged. And my understanding is, as we're working on the updates to the property maintenance code, we're going to get that adjusted.
I think that's language clarification. I think there's some misunderstanding as that's being talked about. And part of that is a misunderstanding from code department, how it works in municipal court, those kind of things.
Okay.
You can only be charged a fine for if you are found guilty of the misdemeanor. That is different than the abatement costs, which are fees that are assessed if you are going through the administrative process. So you got two processes going, right? You got the administrative process that can start before it ever goes to municipal court. Abatement costs, those have fees assessed to them. That is an administrative procedure. If that administrative procedure does not work to get a property in compliance, it can get referred over to municipal court for prosecution for a criminal misdemeanor. It has been the set policy of the city of Topeka's governing body for a long time that the goal of prosecution is not to criminalize poverty or to criminalize people that cannot get it done because of legitimate reasons. So the prosecution's, goal and municipal court's goal through several chiefs of prosecutions and city attorneys has been, if you can get your code case into compliance, even if it takes a while because you have to wait for the cold weather to end, then the case gets voluntarily dismissed so that you don't have a criminal misdemeanor on your record for a code case that has been fixed. We have a whole new focus on landlords, however, which are legitimately a different classification of individuals. But in municipal court, it is the expectation of, the Constitution that people are treated equitably and equally unless there is a legitimate ordinance or law that says you can treat somebody differently. So, correct, which is what this would do. So those cases were being resolved. It was being fixed, the issue was being fixed, and so like everyone else, those cases would be dismissed. If the case is dismissed, you don't have a criminal fine to pay. You're still paying the court costs, those are being assessed. But there's not a fee, it's a criminal misdemeanor and a punishment of a fine. So if you don't have a misdemeanor, there is no fine. It's not that they're not being assessed, it's that they weren't being continued through to prosecution. So this ordinance would allow us to say, because of this special classification that the governing body has recognized, even if you fix that toilet or that sink or that whatever, if you are a landlord and we gave you an administrative process, you took forever to fix something that somebody's paying you to live in, we're going to continue to criminally prosecute that through. And if you are found guilty of a misdemeanor, the court will assess a criminal penalty through a fine, and then that would progress. So I don't think it's as simple as fines and fees weren't being collected. You have to have a conviction to go ahead and proceed. So that gives us the legal basis to go ahead and do that moving forward. Does that help?
Go ahead.
To me, this sounds like it helps because, in effect, what you're saying, we as a governing body have fleshed this out to see that there's this particular group, which is why it's not being treated the same way as a resident, because, they have more power and, control over this property that they own. So my question would be then, okay, let me use the example. There's a multifamily dwelling location in Oakland that has become the bane of my existence and the bane of the existence of the tenants that live there. And they receive LIHTC credits, from KHRC. KHRC is supposed to be able to take complaints from the tenants, and they just pass the potato like they did with Timberley. And so almost 4 years down the road, we're still looking at things that need repair there. My understanding through John Chardine is that they are being fined, but they haven't, I don't think that they've paid the fines, and they've gone to collection. In the meantime, the biggest example I could use would be their front entrance is concrete step entrance that you walk up, and there is so much degradation. There's a big section that is crumbled, and that has been happening. That's been going on for at least 3 years, and it still hasn't been fixed. So with this, and I'm just using that particular example, I'm sure there's a ton of others out there that we could use, would that help put more pressure on them? If not, I understand, I just want clarification.
So I think it's hard to say, because I think the average business doesn't want a criminal misdemeanor, because I think yes, actually, as I think this through. Because if you get the first misdemeanor, because it's still not fixed, then you could continue to have criminal fines that could be assessed on a daily basis for ongoing violations. So after they've been convicted the first time, if they get a second one, you can stack it and get the criminal penalties high enough that it would incentivize you to do it. The flip side, though, is if they're already letting other bills go to collections and they're not paying those, there is a perhaps they would not care about that, because if they already don't have the money and it's going to collections, it will just be a higher debt going to collections.
And then I guess it would be interesting to see, because remember when we had that meeting, when everything blew open with Timberlake, when we had the meeting with KHRC, and how, they said, because we prompted, it would be good to establish a working relationship, to communication, open lines of communication. I'm just wondering out loud right now, which may not have anything to do with this, if there is any possibility where LIHTC credits could be in danger, because you have so many flippin', cases where you're being fined and, in court, and they're criminal in nature, and if that could, I'm not asking you to.
I would need to look at the KHRC.
Yeah, and maybe, but I'm just, and that might be one other thing I don't think that we've thought about in this, and I just thought about it right now.
Yeah, I have not. I know that through some of the recent ones we've worked on, that KHRC has certain requirements for LIHTC credit, but I would need to investigate what those are.
Yeah, thank you, Chair.
If I can back up, because, and hopefully this is helpful to everybody, and when you get a speeding ticket or a parking ticket, it's done. You violated, the fine is on the back of the ticket, and you have to pay it unless you appeal it. So, correct? So how is this different?
Depends on, I'm a lawyer, depends. Depends on what kind of ticket it is. Because certain traffic infractions are not criminal penalties. So if you're parking in a meter downtown, that is an administrative traffic offense where you pay your $10. There are other traffic offenses which are criminal misdemeanors, such as if you park in a hood that is a reserved hood, or you park in a handicapped spot. There are certain traffic offenses like DUIs that you don't just get to pay and move on, you have to mandatorily appeal. So there are all kinds of levels of things in court. Could, as a governing body, you tell us that these are strict liability offenses and you pay them no matter what? Yes. But I'm making up a statistic, but it's probably accurate, is 98% of the people in your code courts are not landlords. They are individual citizens that are struggling to get by. I would highly encourage you, if you have never done that, to go sit through a Wednesday code court. Just sit there and watch who your citizens are that are coming to code cases. I do not think you would get higher compliance with property maintenance by doing that. Most people that are in code, it's not because they just didn't want to do whatever they were charged with.
Really good points. I mean, I see that as something we're struggling with overall. I was there when there was the fines, and we added the admin fees with the idea that there would be a criminal penalty. It's under the Wagner, probably 20 years ago now, but 30, that there would be an admin fee and a criminal fee. So they each have their own track for how they go legally. But somehow we need some sort of consistent system. Maybe this is...
You do have a consistent system now. The consistent system of the governing body has been compliance, because most of your individuals, like I said, are not this landlord. So the administrative track was started as a let's not get people's criminal, I mean, it affects you if you are a citizen that is low income, that has a criminal history. So I don't know that it's probably good public policy as a first step to start funneling all your citizens straight through to municipal court, which is why an administrative policy and procedure, which we have, makes a lot of sense. If you can resolve it administratively before someone is sent to the criminal track, that is ideal. Now, as you've dug into changing the culture of property maintenance and you challenged me to, okay, but there is this other segment over here of landlords that are not those people that need to be treated differently. That's how we came up with the LLC ordinance. How do we get these people to court? Right. This ordinance helps treat those groups differently with a statutory framework that we can rely on to show that that's equitable. But your other group of citizens, you do have a consistent process. It goes through the administrative process. John Chardine's team has guidelines on how long they will give people before it truly moves over to the municipal court side. Judge Thadani has guidelines. Even we have guidelines on how long they're given for time to pay if they are found guilty, those kind of things, to really try to stop people from getting moved into a cycle. There was a report pre-me, Judge Thadani could get a copy of it, looking at our municipal court post-Ferguson to make sure that we are not a Ferguson court. Part of that is because we do have an administrative process and we do wait and do not try to send individuals for criminal misdemeanors for code cases if we do not have to. And we do dismiss the cases if they comply so that they do not have that on their record, which can impact it. So I think as you look at those things, it's a very complex cycle, and it would just, I advise you to move slowly on that.
No, that's why I asked you, because I think we made some assumptions about what it did when we got started and found out later that we misunderstood. And so as we're moving forward with this consideration, as well as just the whole package and what's working, because there's a difference too between something, as we look at what we're inspecting and writing people up on, what's a life safety thing versus a cosmetic thing. And if we're going to write people up and put them through this whole process, that kind of thing too.
And our prosecution team, lots of shout out to Kelly Trushell. She spends a lot of time with various departments. You know, pre 2 years ago, zoning didn't realize when they had real zoning issues that those could be prosecuted and moved forward that way. We have, prior to probably 3 years ago, I don't know that we'd ever shut down something like an illegal haunted house that was endangering children, but we do those things now. Code knows that they can call Kelly if it's a life safety issue, and we'll be immediately getting those moved over to the prosecution track. So we have done a lot of those kind of things to speed it up. It's not things that you often see, but those kind of things are being done. It is hard to have a one-size-fits-all that is going to fit every scenario because we see such a wide variety of individuals in our court system.
And another piece that has come up is how does it work for somebody to become a repeat offender at this point?
This will help that because right now it is hard for a landlord to become a repeat offender if they know that they can fix it and get a case dismissed.
Exactly.
But if they get prosecuted, even if you comply, then it becomes a repeat offender situation. So this ordinance would help with that.
Thank you. Because that was also something that as we stopped and looked back, it was like, uh-oh. Thank you for that. What is, Councilwoman, you got this started, you've got it here. What is your thought about if, obviously we need to think about this a little bit, but would this move forward on its own, or is this something that we would incorporate? I know John's getting ready to move forward the overall changes to the code.
I think it would be helpful if you moved it forward on its own, regardless of the codification and the updates, so that it's clear in the record that we had an established public policy. These have whereas clauses, those kind of things, which would not normally be in a codification ordinance when you update the IPMC. So I think it would be helpful if this moved forward on its own as an ordinance separate.
And to your point about the whereases, normally those are not codified, so they would be part of the getting it passed, but they would not go into the ordinance?
These would be part, this would not be yes,
It's okay.
to your point. Okay. It will be part of the ordinance. It will be a past part of the ordinance. The whereas clauses would not generally go in the codification portion. That would pick up on section 1. So
Correct.
the code wouldn't have the whereas clauses, but we would legally have them as it passed
In the
so that we
history.
could rely on it. Yes. We could put the whereas clauses in the codification. The codification company will probably just be annoyed at me, but we can
Understood. I'm
figure it
just
out.
trying to, just to clarify for all of us, where that goes.
We can talk to the codification company and see if it's possible.
Okay. Well, thank you for this. Let's go ahead and let's plan to put this on our May agenda for consideration. So we've got a chance to look at it and think about it and move it forward from May. So it'll be on our May agenda for action. Thank you so much.
Happy to answer questions if you have them in the interim.
And again, Councilman Kell, I can't see you. Any questions or concerns before we move on? Is he gone?
He's on there. He's still online.
All right. Well, he's not talking, so I guess we're all right. Thank you again, everybody. Let's move on. I think we've got one update from marketing and communications, and then we'll move forward. Thank you, Dan.
No problem. Good morning. Dan Garrett, Director of Communications. I'm providing a quick little update on behalf of Monique. She apologizes. She had an emergency. The deadline for the judges to respond for being a judge on the Yard of the Month campaign is Friday. So after that, we will be able to move forward. We'll have the judges selected. We have created a short survey that for people to fill out if they want to nominate a yard. It's just a few questions, so it encourages people to nominate, and we'll get that going. We've got the yard sign designed and picked out, so we can order that. And then on an update for the community cleanup, Monique will be providing a more in-depth update soon, but they have an idea for the direction for that to go. So is there any questions? I know it was a quick little update.
Well, we're eager to hear, because I saw those minutes, and I guess city manager had new ideas,
Yes,
so whatever
yes.
they're cooking. Councilman.
I have a question about those names we were supposed to submit. Okay?
For the judges?
Yes. Okay, at this point, have you received any names at all?
That I'm not sure. Monique would have those, but I believe she reached out to the names that were submitted, and the deadline is Friday. So
Okay.
we'll have an update after that.
Thank you, Dan. Thank you, Chair.
Sure. Anybody else? Thanks so much.
Thank you.
I'll look for, where are we in what's going out in the public communication, education communication?
We have drafted press releases and graphics made, and so as soon as we are ready to go, we can launch it.
All right. Thank you. In terms of our next meeting, Nicole has been really buried in Tyler and still building our data, converting the data into the new software and so on. So we will be meeting within the next 2 weeks to confirm the overall action plan for changing our cultural property maintenance. You've all seen the draft of it. It just needs to be finished out with all the names of the partners, which we worked on a little bit this morning too, and the calendaring. I think we'll be working hard to work on that retaliation and tenant health and safety protection early. Again, IPMC's coming up. And various things are percolating about vacant properties. So we will have that for our next meeting. Anything else? Any updates from anybody else? If not, I double checked with Brett. If these 9:30 to 11 a.m. meetings for this committee work, our next meeting will be May 21st from 9:30 to 11. if there is, yeah. Unless, Councilwoman, you're thinking we want to go longer, can do it right now. For our May meeting, you were talking about 2-hour meetings, so we've been going at an hour and a half.
Well, I was only referencing that when we have our possible partners coming in, and so we can dive into it, so I don't know.
Well, let's plan on keeping the 9:30 to 11 at this point. We'll look at balancing time and what next steps are for the relationship with them. With that, we're adjourned. Thank you.
Thank you.